Hi, it's Dr. Miskoff. It's March 21st, 2020, and it's 10:20 p.m. Sorry for the delays today. It was a long day fighting off the coronavirus and COVID-19 and complicated by a broken phone. My phone was cleaned so much that it actually shorted out, and I just spent the last hour or so chatting with Verizon to get a expedited phone ship, which I should have in the next 48 hours, hopefully. Wasn't sure if the Verizon stores would actually be open with a shutdown mounting here, and so if you do need to reach me, I will be using my email and my wife's phone, Bernadette. It's one digit less than my phone number, so my phone number ends in 45, hers ends in 44. So if you need to get me, just contact me that way for the next 48 hours. Tonight I want to talk about ZPACks because there's a lot of commotion around town about not only plaquenil and hydroxychloroquine, but also ZPACks, and there are people that are, stocking up on these, which I don't think is necessarily the right answer. I got a text earlier from a patient who was concerned that his pharmacist had told him that, doctors are prescribing this to their patients prophylactically. I think, it's important to note that there are no placebo-controlled, double-blinded, randomized trials for anything in regards to COVID-19 completed. And we certainly don't have the evidence, and we don't know what's going to really be the best dosage for these things and what is going to be the best cocktail of medications. Time will tell with that, but for now I would suggest that you do not call your providers for prophylactic medication, whether it be a ZPACK, azithromycin, or hydroxychloroquine or plaquenil. We did talk about supplements before, and vitamin C and melatonin and zinc, and all of those things are over the counter and, can be taken just for general reasons and general health. There's no evidence at this point in time that taking these over-the-counter supplements will prevent anything either, except maybe the common cold with vitamin C. We've seen that story in meta-analysis, and over 200 milligrams, did shorten the course of the common cold in adults and kids, and that's been looked at in the past. So, some have asked me, what dose of oral vitamin C would you take? And if you look at these meta-analysis, usually they were over 200 milligrams or more. PO, but we don't know if that's going to do anything for the coronavirus, and especially the oral forms. We'll talk at later times after I gain more knowledge on the IV forms, which we are using, and I will be talking to some experts soon in regards to that, some that are looking at it in even Wuhan, China, and there's a doctor reaching out to me even this night who had watched the vlog and wants to give me some more information, so I'll keep you guys updated on the IV forms for treatment. But again, the prophylaxis, we just don't know. Back to ZPACks, they have been helpful antibiotic for several decades now, and certainly we've used it for upper respiratory infections and even lower respiratory infections for pneumonia treatment. Widely used. It is typically well tolerated. There are some GI side effects, but again, this should really be reserved for treatment of, at this point in time, on-label indications, as we just mentioned. So I don't think it's a good idea, as I said, to call up your clinicians. They're getting flooded as it is with all kinds of questions regarding symptoms that they're having, and when's the office going to be back up. As I alluded before, a lot of offices are moving to a telemedicine model, and rightfully so, and the laws are loosening in regards to that. The American Telemedicine Association, I believe, has a website that has more information if you're trying to reach your doctors and healthcare providers, nurse practitioners, and PAs as well. Then stay tuned. I think most of their websites and have already reached out, and most have signed up for at least a free version, but we are getting inundated with calls, and our EMR is actually down in regards to e-scribing. We're manually calling these in most cases. So it would be very important to wait until we have more definitive evidence in regards to ZPACks, and I would not recommend calling for a prescription at this point in time. If you feel sick, if you have a runny nose even, if you have a fever, for sure, cough, shortness of breath, absolutely, then these are reasons to reach out. Again, stay tuned for more in regards to azithromax or azithromycin in the future. So we'll keep it short and sweet tonight. Again, I'm hunting for a new phone, which is on order. So we'll keep it brief and get some good rest. Get those melatonin levels up. Remember, when the lights go out, melatonin levels go up, and when the lights come on and it's bright, melatonin levels go down. Hopefully, we'll have more insight into melatonin in the future as well. So have a great night. Be well. Stay healthy. And tomorrow will be my 7th day in a row fighting COVID, and then I will have a week off where we will regroup and continue the vlogging, try and figure out some good topics. And eventually, once we get up to a critical mass of, I would say, maybe about 1,000 subscribers, we may even take this live or even bring on some other clinicians for interviews. I think that would be cool. And at some point, I'd like to do a question and answer session if possible. I'm not exactly sure how to do that. I'm still getting better with the technology, but I think we'll figure it out. Have a good night. God bless.